Our show is live and interactive. We're on WhatsApp on 0548 501 584. And we're also live on YouTube on Orange 107.9 FM. Now, when you go on YouTube, spend a couple of seconds to subscribe and like our page and hit the bell or the notification button so you can, know when we're live. So this morning, we're talking about reproductive health, especially in women, and so we're going to do something a bit different. Today, we're going to be talking about a lot of things when it comes to reproduction and reproductive health and contraception and everything else in between. But the good thing is that today, because of the challenges and how people usually want to, be discreet about reproductive wishes and everything else, we're going to do a mixed bag in terms of the language. We're going to mix up all the Chi and the English and make sure that we're really, really breaking down the conversation this morning. Yes, so welcome to Orange Out Lounge, like I said earlier. Abigail and Agyeiwaa, welcome.
Thank you.
Okay, so you have to move your mic slightly closer so that we can hear you. But how have you been?
Oh, by His grace.
Oh.
We are still surviving.
All right. So, okay, let me start with this. Why is that when people want to do contraception, or when people want to do anything related to family planning, I think the natural cue for people is to hide or not tell anybody about it. Why is that?
Thank you, Doc, and good morning once again. It's pathetic in our world, in our side of this world, because of the misconceptions around family planning and women's reproductive health issues. So I think it's all about the misconceptions.
Okay. So, yes, the misconceptions are there, but this is normal. It's natural, isn't it?
To a group of people like the health professionals, it's normal.
Mm-hmm.
But to the lay Ghanaian, it's not normal. Going in for such a procedure, it makes you an unclean being.
Abigail, so this week I had a patient who, I think she's about 16 years. So
okay.
I chanced on her at the labor ward, and she was having a baby. So after delivery, I was like, you know what, you are young, so we have to consider post-delivery contraception.
Okay.
She was like, oh, Debbie, my name and uncle discuss answer.
Yeah. You see, most is about our culture, where we are coming from.
Mm-hmm.
We see our parents, our oldest, our grandparents, they were giving birth to a lot of children.
10, 15.
Yes.
Early stages.
And at early stages. And they didn't bring in that mindset of having a family planning.
Okay.
Like having a huge family. Yes.
I like that,
so
huge family.
Yes. If someone is staying with their grandma, and the health personnel wants to discuss something about family planning with the person, it doesn't see the necessary, the need to accept it, but rather wants to believe the conception of the grandma.
Okay.
Yes, in the family
So,
planning.
Doc, this comes to the fact that all these things should start from the home. Because if the grandma had ever mentioned to the girl that there's some form of medications to help space childbirth, this girl could have even have a fair idea about it. And these grandmas, they put in a lot of issues in your mind, creating some kind of impression about certain issues. So you going in makes you
No, but you see, I always operate from the perception that family planning is there a local expression for family planning, like a proper Chi word for family planning? Bibisa awo hɔ.
I want it to move.
I want it to.
Is that enough? That expression, is that enough to?
Doc, even in our language, family planning is not only about spacing. Yes, it's not only about spacing. It's also about improving your reproductive health.
Okay.
So yes, sometimes you would, and it's not even also about the number of kids to have. Plan it. If you want to have 10, know how to plan it. If you want to have 2, know how to plan it. Some people will want to have 2, and within a space of 1 year, they have the 2. So it's not good for your health. Yes. So family planning is not even just about the spacing alone.
Okay.
But everything around your reproductive health.
So you may want to have 2.
Yes.
But even the 2 that you may want to have, how you have the 2.
Yes. So it's not only about the spacing, the number, and it comprises a lot.
But Gloria and Abigail, you see, we also have Mia Debia Mete, and or one time now sorry so. What is that? So you meet a relatively younger person, and she's, like she said, within 3 years she has 3 kids or 2 kids, and you're like, oh, why aren't you spacing them? Oh, me and internal sorry. So is that advice that comes from midwives?
No. Why I say no is when it comes to like a client who have had a cesarean session, one previous cesarean session, and you tell yourself, oh, person won't tell now, sorry, so. There's a scar to your uterus that you need to have time to heal. The uterus have to heal to be able to carry another pregnancy to term, so that you don't have any ruptured uterus during the pregnancy, late pregnancy. Yes, and you say, oh, per se, and it's going to affect your health.
But is it something that we tell women consciously or actively? I'm asking because you see today we're talking about a woman's reproductive health, but some will argue that they have never heard anybody say it before.
Those who normally say me person me won't tentem, it depends on their age. Okay. Yes, most of them. If a woman is having starts giving birth around 30, 32, 35 years, or person won't tentem because he think the age to have another pregnancy is going to have some health implications. Yes. So she wants to have, if she wants to have 2 or 3, she wants to have it within some years and before she's 40 years. Yes. So I think most of the time it's based on the age. Okay. Yes, the age of the woman.
So if, say, someone is listening and they are hearing us talk about a woman's reproductive health, what is the normal fertile age of women? Because there's a lot of misconception out there that, oh, when you do 35, I want to mean. So what is the normal reproductive age of a woman?
Doc, thank you. You know what? Let me even define our health for us. It's a state of physical, emotional, social, and psychological well-being. This is in relation to the because today we are talking about the reproductive.
Financially.
And financial well-being of an individual, and not merely the absence of a disease or infirmity. Yes. So if you are going through something, sometimes it's not physical. Sometimes it's not emotional. It's not. But whatever is affecting you within the reproductive system, it's not a good health for you.
So
if you are pregnant and emotionally you are not stable, you are not in good health. If you are pregnant, especially as she was talking about cesarean section, you've had cesarean section within 6 months, you are pregnant again. Personally, you are not safe. Even though sometimes with proper care, you can end the pregnancy successfully.
Mm-hmm.
Because you were told to at least stay away from pregnancy for the next 2 years before another pregnancy. Just because of that, psychologically, you're also not stable. Because you think something might happen. So when it happens that way, in fact, even your visits to the clinic become even more. All because you fear that something might happen. So even doctors even have a special treatment and care for those people, those with short interpregnancy intervals. So it's a burden on you yourself. And you asked about the right fertility age.
Like the fertility age, because everybody says theirs differently. Some will say, oh, once you start menstruating, you are fertile up to the time it stops.
Yes,
Some will also give you pressure and say, after 35 days, don't even try.
Thank you. Just after menstruation, you started ovulating.
Okay.
At that young age, you have a lot of ovaries, very strong, active, and vibrant ones. So you are very fertile at that stage. So if even you read a lot of journals, it tells you that between the ages of 19 to around 30 years, you are very fertile. But coming down from the 30 years, you start reducing the eggs.
Okay, so the quality of your eggs reduces as you age.
As you age, yes. So that is why people might encourage you to have your kids within that age. But then now, because of schooling and other things too, people also have theirs at the later stage, and they are having it too.
Yes.
Yes, but you know what? Those people can find some difficulty along the line with their fertility.
As they age.
As they age. As compared to the 19s, the 20s, and thereafter.
If you have if your age is around 35, 40 years and you are pregnant, we put you at high risk. You are monitoring for the pregnancy. Yes, it will be different from somebody who is 25 years and being pregnant. Yes, because you are at risk of maybe having high blood pressure, at risk of diabetes
and everything else in between.
Yes.
Okay. So if you're just tuning in, this is 107.9 Orange FM. We're 40 minutes past 8 o'clock here on Kumasi's Music Leader. This is the city's #1 health talk show, and as always, we're here on Saturday mornings between 8 and 10 o'clock, and then we discuss healthcare. This morning we're talking about a woman's reproductive health. If you're a man and you're listening, you're not out of this conversation. This conversation really matters to you as well, because we're partners in this business of getting women pregnant. And I think men are very influential when it comes to a woman's reproductive choices, no? Very, very influential. I don't know why, but we decide what women do when it comes to their reproductive health. So today's show is essentially about reproductive health. If you have a comment, if you have a question, if you've done, for instance, family planning, because we're going to go there in a bit, I want to hear your experience. Let me say it in Chisa. Why are family planning that? A person family planning now, a home benefit and I say, well, the way benefits be negatives in because one of the things with family planning is that usually as soon as you mention family planning, the next is obise or miye bina. So let's talk family planning. Is family planning a good thing? Well, I mean, is family planning a good thing?
Family planning is a good thing. It's a good thing when you're able to seek healthcare, talk to your healthcare provider, and the healthcare provider is able to take your vital signs, your BP, everything, and take you through all the types of the family planning. And based on your assessment, a right choice is being taken. Yes. Nowadays, most of the family planning that method that our women take, they don't go to the hospital. They go to the pharmacy. Yes, and purchase them. And when you purchase that type of family planning
When you
method, you
make
don't know if that one is really suitable for you.
You know,
Depending on your health issues.
You know, I'm just on an app.
Yes.
And I have just seen, you know, they are marketing an emergency contraceptive.
Yes.
Just on the phone.
Yeah.
So people are ready to go to a pharmacy
And purchase
a method.
Yes.
But so if somebody is listening for the first time and the person doesn't know, like, name the process about purchasing family planning, what is the right way to get family planning?
Okay, so thank you. It's about the decision. Now you've decided to plan your family. If the decision is taken, take a move. Don't just sit in your house and make a choice. Get to your health professionals. You go to any reproductive health center in any of the hospitals available to you. They are there to explain and make you have an informed choice.
You're listening
No one
in
will
color.
choose for
Orange
you.
107.9.
After going through your health, assessing you and doing everything for you, they will help you to make an informed choice. So if you make the decision to start planning your family, don't plan it in the pharmacy shop. Don't plan it in your own room.
Okay.
Come for assistance, because there are a whole lot of things you might not know.
Okay.
You might think that taking this will help you, but eventually it's going to cause more harm than good. So when you make the decision to plan your family, please visit your health professionals to explain a lot of things to you before the choice is being made.
So, I mean, if you're just tuning in, this one we're talking about a woman's reproductive health with two experts in the field. And the advice is that if you want family planning, don't just walk into a pharmacy and purchase the drug. Because, I mean, the medications are...
You're listening in color.
They are common.
Orange 107.9. Orange
and
107.9.
They have their side effects. Yes, they have their side effects. So when you come to the hospital, they're able to sit you down and tell you, if you take this, this is going to happen. It's going to happen. You are expecting that when you take the family planning, maybe you have your monthly flow. You are expecting your monthly flow. It may not be that for a particular family planning method. So when you come, the healthcare personnel will take you through all these things, tell you if you take this medication, this is what will happen to your system. So you get to understand how the medication is going to work in your body. So you appreciate it when it comes. Yes. And they will tell you when it's happened, when you have started bleeding for a very long time for this, you have to report. So you're able to report back.
Okay.
Yes. And whatever you have to do for you, it will be done there. It will be done for you. But when you sit and you take the medication, you don't know. Most Ghana, when we buy medication, we forgot to read the leaflets.
No, at the time we are buying the medication, pressure dies.
You know what? No, most of the family planning drugs that are being sold at the pharmacy shops, it contains a high amount of the drug needed because they are emergencies. So it distorts the system
You're
altogether.
listening in color.
Yes,
Orange
because it's an emergency.
107.9.
That is why we don't go into emergencies for a long time.
For some people, every day is an
Every day is
emergency.
an emergency. Nothing happens. It means you are causing more harm than good to your body. Most of the drugs, if you go in for maybe IUCD, as an example, you go in for it, the pharmacist cannot insert it for you. You have to come to the hospital for it.
Okay.
Like for the procedure to be done for you. Yes. But those you can take at the counter, they are the emergency ones. And it doesn't help your system. For you to return to your normal flow, your normal ovulation time, it takes a while.
Okay.
So please, let's report and stop the emergencies.
The daily and the weekly
The
emergencies.
daily and the weekly emergencies, it's not helping us at all.
All right. This is 107.9 Orange FM, and this
You're
morning
listening in
we're talking
color.
about women's
Orange
reproductive
107.9.
women's
Orange 107.9.
reproductive health, and we're also talking about We begin the conversation from contraception. Do you have a question about contraceptives? Do you have a question about contraceptive choices? Are you listening to us seriously considering family planning? Are you when I say like, are you serious family planning? Just because sometimes you've had one or two children, you want to space them, or you are in a relationship and you are not ready. What is your situation? The experts are here. They will give you the right guidance. You can send your comment in either by text or voice notes. We'll open the phone lines a bit later on 0548 501 584 0548 501 584. So talk me through the options, like the procedure. Okay, so someone is asking, at what age can someone confidently come to you and say, I want family planning? At what age?
Thank you very much. This doesn't deal with ages. If only you are sexually active, yes, and you are not ready for pregnancy, you need to visit the facility so that we plan it for you. Because if you are sexually active, the next thing is to be pregnant. If you are
You're
pregnant
listening
and you
in
don't want
color.
it, you might
Orange
terminate the
107.9.
pregnancy, which sometimes you want to avoid. So if you know you are sexually active and you are not ready for pregnancy, you should visit the facility for family planning.
So if you know you are sexually active,
Yes.
but you are not ready for pregnancy,
Yes.
does age matter?
It doesn't matter.
Okay, so let's say
Doesn't
somebody
matter.
is 14, 15, 16, 17.
And you are sexually active.
You should come.
You should come.
You should come.
Can you come to the family planning unit alone, or should you come with an adult? Someone.
Because that age, like 14, 15, they are underage. Mostly they come with their parents, especially some parents, when they see that their children are sexually active, they would want to avoid the pregnancy. They wouldn't want the child to get pregnant before they go through all the stress of avoiding the pregnancy or yes. So some people come in with them, and others too, they just come in themselves. So I remember when I was in school, I did a research on the adolescents, their mentality about family planning. Most of them didn't know about it. In a second cycle school in Kumasi, most of them didn't know about it. And those who even knew about it, they heard about it through their friends. So if you are not able to teach them, their friends will teach them. And which one are they teaching them? That is the problem. So they can just walk in. If only you are sexually active and you don't want any unwanted pregnancy, just walk in. No one is going to tell you, or no one is going to look down upon you. Just walk in. We are always ready to provide the services.
Okay.
We will take you through the investigations, we will take you through the counseling and everything. And we can help you to make a right choice.
So
Don't feel shy.
Don't
If
feel
only you
shy.
are sexual, because when you are going to have sex, you don't tell your parents.
And they should bear in mind that when they come, whatever they tell us is confidential.
it's confidential.
Yes, it's
You
confidential.
won't tell their parents.
And it's
No, you see them outside, you don't even recognize them.
It's
They might
confidential.
recognize you.
Yes.
Look, you being a doctor, do you recognize your patients? You don't. There's those who come there frequently, and family planning, they come as and when it's needed.
It's needed.
Yes. So you get to know the person if the person walks in frequently. But then if she comes and goes.
Okay, so there's all right, so you can also send your comment on 0541 022 318, 0541 022 318. So there's a parent who is asking me that when a parent, when a parent wants their, teenage daughter to have contraception, simply because maybe they don't know whether she's sexually active or not, but they want her to have a certain contraceptive method that they know that they can literally close their minds and she's not going to surprise them with "I'm pregnant." What options are there? So I want us to talk about the options. what are the family planning options that are available? Like one after the which ones are readily available?
Thank you. So with the family planning methods, we can group them under the hormonal and non-hormonal. We can also group it under the permanent or the permanent and the temporary ones.
Okay.
The long or the short, yeah. So with the hormonal ones, they come in the form of injectables, pills, oral medications, yes, and implants.
Okay.
So with the implants, we have two types. We have the Jadel and the Nesplanon. So
Nesplanon.
Yes, please. Yes. So with the Nesplanon, it's just one rod. We just put it at the upper arm. Yes. The inner upper arm. So that it wouldn't be visible.
Sure.
Yes. So it's just one rod, and it takes you for 3 years.
Okay.
For 3 years.
3 years.
Yes.
So within those 3 years, will she have her period? Will she become fat? Because those are the questions that I should ask you.
Thank you. So it depends on the individual. How your body will react to that extra hormone you are adding up to your body. Some people will gain weight, others will also lose weight. Some will come and remove it because they are losing weight since they inserted it. And some will come, they will tell you that they are putting weight after having that.
After inserting it.
And some will have it and still maintain their normal weight.
Okay.
And you know what? Anyone who comes in for family planning, the day she comes, the following day, whatever happens to that woman or that lady is as a result of the family planning. So if they have that method, nothing should happen to them. Yes. That is the issue we are facing now. Yes. Yeah. If they are on the method, whatever happens to her is as a result of the method. You are gaining weight. Have you checked your diet? You are losing weight. Have you checked your diet? You are not menstruating because you are not ovulating due to the method you are.
The method you
so
you
when
choose.
You come, that is why we inform you about all those things, so that when you go through it, you wouldn't be alarmed. If you are bleeding, come. We have something to counteract that effect.
Okay.
Yes. So you come to the health professional. Whatever is available, we tell you, and whatever to expect, we tell you.
We also tell you. So we've talked about. So that's the 3-year one.
The 3 year and the 5 years is also 2 rods.
5 years.
It's also 2 rods. Yes. Okay. So this one is 1, and for the 1 is for 3 years, and the 2 is for 5 years.
Okay.
Yes. So that is the implants.
Okay.
And that one is inserted at the upper arm of your. At the upper arm. Yes. And we also have still on the hormonal, we have the injectables. That one we have the depot, and we also have the Norplant. So with the depot Vera, when you take one shot, it takes you for 3 years. So every 3 months. 3 months. Every 3 months you come in for your shot.
Okay.
Every 3 months you come in for your shot. The next plan, Norplant will take you just 1 month.
Okay.
So every month you
come for the injection.
Yes, for your injection.
Okay.
So with these hormonals too, we also have the orals. We have the combined method, and we have the progestin only.
Okay.
Yes. With the lactating mothers or the nursing mothers, mostly we don't give them the combined because of the estrogen. Yes. It inhibits the production of prolactin.
Okay.
We don't give it to them. So they mostly take the progestin only. That is for the oral. Yes, please. And we also have I think I've exhausted the hormonal. And with the IUCD too, some are hormonal.
Okay.
Yes.
So me and you, we know IUCD, but someone at home has not heard IUCD before.
Yes. So it's the intrauterine contraceptive device.
Still, I don't understand.
It's inserted.
The two are
within.
Yes, the two are within. I know all can say you will 2 types. I about quite a woman, and about quite any. I know a copper and a DIA.
So I wanted to exhaust the hormonal ones before we come to that. I brought in that one because one part of it contains hormone.
I understand. But I want us to, like Abigail has started, the IUCD,
But I should say, I'm kind. Yeah, the two I would in. Na hormonal. Yeah, the two I would in one. The ANSA it produces mucus. Or service no. I know. When you have an intercourse, it prevents the sperm from entering and meeting the release egg. And the copper one is make the environment unfriendly for the sperm when you have intercourse.
Okay.
So that also is a mechanism of preventing the pregnancy. So these are the two mechanisms.
Okay.
Yeah.
So we have the you see the IUCD, the kind, the shower with the okay. Is it painful? Because I decided to ask you, is it painful?
No, I always tell my clients, it's not painful, but it's uncomfortable
It's not
during the
comfortable.
procedure.
How long does that procedure take?
In a space of 10 minutes, you should be getting up. 10 minutes, you cry what?
So it's not an operation?
No. It's just a minor insertion. You know what? We are putting it into your uterus. So definitely we have to view your uterus. So we have to view the cervix so that we'll pass it through. That makes it uncomfortable. Yes, because we are going in there. Aside that, the others is just a superficial distance. But this one, we are going inside the system. It makes it uncomfortable. Even exposing yourself, some people even find it difficult exposing themselves. So it's uncomfortable throughout. But then when it's inside, you don't feel anything. Within the first 3 days, you might feel some cramps because there's a foreign body in your uterus. You might start feeling some cramps. But when the uterus adjusts itself to it, everything goes down.
And that one, how long can it stay there?
It can stay there for 10 to 12 years. For the non-hormonal.
For the non-hormonal.
Yes.
So the one that doesn't contain hormone can stay there for about 10 to 12 years.
Yes, please.
Correct.
And the hormonal one stays for 5 years.
So after 5 years, you can go and take it out.
And put in another one.
It's bang on 9 o'clock, and I hope you're learning something. This is the Orange Health Lounge. You can join us with your comments or questions on 0548 501 584. That's WhatsApp only. If you want to call and ask a question, 0541 022 318. 0541 022 318. That's if you want to call. But if you want to send the WhatsApp, it's 0548 501 584. We're having a very rounded conversation about contraception and everything else in between. I know people have varied experiences with contraceptive use, like very, very wild experience with contraceptive use, and I want to hear it from you. Was it comfortable? Was it uncomfortable? Are you still using it? Have you stopped using it? Is there a particular reason why you decided that you're going to stop the contraceptive use? Like this nice young lady has sent to me. So what she's saying is that can you opt for the IUCD in your early 20s? Because taking the pills and the injections are okay. So the injections are uncomfortable, and taking the pills, she's saying that you may forget. So can you opt for the IUCD in your 20s?
It's a method, so you can opt for it. It's a method, and you can opt for. And return to fertility is instant.
Return to fertility means that
like when it's there and you remove it today, you ovulate tomorrow and you have sex.
You can get pregnant.
You can get pregnant.
Okay.
Yes. So it's available to all, and it's just that when you take it, we tell you to take extra care of your reproductive area. Don't be indulging those chemicals there because there's a foreign body. You are prone to infections. Sometimes if you don't take care of the perineum and other stuff. So be careful so that it wouldn't cause any infection within your uterus for it to cause harm in your next reproductive stage.
Yes.
Yeah.
Okay. So maybe in your 20s, it doesn't matter. It doesn't
matter. You can take it, but be extra careful because we don't don't want you to be having infections therein and because you know when you're having infection within the uterus and stuff, it might lead to some form of infertility.
And in case you have infection, you don't stay home and treat yourself. You have to come to the hospital because you are having that procedure. Yes, you have to come to the hospital so that we know what infection is going on. We know the particular medication we can give.
And you could be having infection, but it couldn't be due to the.
Yes.
It may not be due to the IUCD.
And a medical can when you family planning and BB is a method.
So someone is asking me to find. Okay, this is a husband. It's good that husbands are also asking questions this morning. So what he's saying is that the IUCD, he knows it has a rope. It's not a rope. It says that there's a string attached. Maminka string. There's a string attached to the IUCD. Will we feel it?
No, look, when we insert it, we try as much as possible to push the string at the posterior funnels so that you wouldn't feel it. And even with time, it becomes softer.
Okay.
Yes.
And it's coiled in there.
It coils in there. At the initial stage, the strings are a bit hard.
Okay.
So if the person has an idea that
you've done it,
that person might feel it. But if the person has no idea,
it's normal things.
It will be a normal. But we want that idea, and when it say, no, you've gone in for this, he will feel it. And with time, it even stops and it falls back to that place. You will never feel it again. Yes. But even with the woman after menstruation, we tell you to find out if the thing is hanging down. And it means if you, the woman, you feel your strings down there, it means the thing is not in position. You might get pregnant, yes. So after every menstruation, especially when you realize that this month you've had a heavy one, heavy menstruation, you have to check if the thing is still
there.
Yes, please. So as a husband, you wouldn't feel it. You will feel it if you have the idea that your wife has gone in for that thing. And with that one, with time, it will all fade away.
But husband should know. Tell us you. Anna.
Yes. Some people are against the fact that their women are going in for
family planning.
Yes. So the woman will hide and do it. This same man we are talking about would even give a helping hand when this woman is pregnant, when the woman has delivered and stuff, not even supporting financially. And so one also really go in for such a method. So this woman will hide and do it. And some women too, they also come in with their husbands for the treatment, but they secretly come back and remove it because they also want to have more. So it's a two-way affair. It's a two-way affair.
You have to agree.
Yes. Some women get pregnant and their husbands will never talk to them.
And sometimes it's a religious background.
Okay.
Where the person is coming from.
Okay.
Depending on the church or the religious.
Okay.
Yes.
Some churches are against
it. Against this, and they've been married to the husband is in the same religion and doesn't even accept family planning method. But the woman mental because of education that the person has had and the effects that you think if I get pregnant will have on me. She wants to have the family planning, so she's going to do it without the knowledge of the husband.
And it's accepted.
Yes, it is accepted. And we
you have rights over your body.
And you have to.
I'm 0548501584. That's a WhatsApp line. You can share your comments or your questions with me this morning as we have a conversation about women's reproductive health. What has been your experience? Are you thinking about contraception? If you're a young lady and you're listening and you're concerned about your reproductive health, what is it about your reproductive health that concerns you? What is it about your reproductive health that you wish you had somebody to talk to? The opportunity is here this morning. You don't even have to call. You can just send it in a text and I will read it out for you. 0548 501 584 0548 501 584. So, the contraceptive methods that you've talked about, so the hormonal, the non-hormonal, long acting and the short one. All those ones are nice. But we stopped talking about condoms and those things. Is it because they are no longer effective or people don't like them?
So my next statement was that, look, we have the natural methods too, which people are using and it's working effectively for them.
Natural method.
Natural, yes.
Any idea?
And on a calendar, so if you know your dates, you know when you are ovulating, you know when you are menstruating, you calculate and you know your safe periods. Yes, and your unsafe periods. And it works for people. Abstinence too is another method of family planning.
and when it comes to the postnatal women, also the one natural method they can use is the lactation amenorrhea.
Okay, so like when you are breastfeeding.
Breastfeeding exclusively.
Exclusive breastfeeding.
Exclusive. The word is exclusively breastfeeding, not adding any
artificial.
Yes, artificial.
Okay.
And breastfeeding the baby on demand. Yes, morning, afternoon, evening. You don't space it much. Yes. So that also prevents you from ovulating, and thereby when you have sex, you don't get pregnant. Yes.
So the natural methods too are there. The condoms too are there. But people use the condoms, doc. They use it. They really use it. But you can sometimes feel because it can break at a point. And sometimes the pressure on you can even make you not put it on well. And it can cause another whole...
Agyeiwaa says special.
Yes.
So someone is asking me to find out from you that, you see, when it comes to, he's saying that the calendar method or natural method is full of anxiety because people simply don't know how to calculate this safe period and unsafe period.
That
and
is
all
why
those.
we are always available. When you come, we explain all this to you for you to know your safe periods and your
When you give your menstrual
If
cycle,
you don't know it, you cannot use it. Yes, it can help you for 2 months and the next month you are pregnant. Yes. So please come in for us to educate. We wouldn't have much time to do that here this morning, but it works for people.
It works for
Some
people.
people have not gone in for the artificial methods before. They are using the natural method and it's working, especially if you have a regular menstrual cycle. If you don't have a regular menstrual cycle, especially this month, it came within 26 days. The next month, 23 days. The next month, 21.
35 days.
Yeah, 35. You don't have a regular cycle. But those who have a regular cycle, that every 28 days, she knows she's having her menses. She knows between 10 to 14 days she's going to ovulate.
So even how your menstrual cycle is influences the choice of the method.
Method you go in for.
But why is it that, I don't know, why is it that some of these things, when people are buying contraceptives, they don't tell them or they don't even think about it? Because like you're saying, maybe somebody may have a very long cycle.
Yeah.
You know, because I had a patient who had like a 38-day cycle. And, you know, I was telling her, you know, your contraceptive choices are very few if you are really scared about getting pregnant. And I prefer safe options. So go and find out UCD, and that one is close to your mind and sleep business. Yes, but for most people, every time that they are around their dates, it's full of anxiety. You know, people can buy a pregnancy test strip every month, every day.
and you see, our natural body, as female, when you're ovulating, you see the level of libido is also very high.
Oh, sir.
Yeah. So it makes it unsafe.
Agyeiwaa hasn't told me.
It makes it unsafe. It's not, yeah. So that you get pregnant
And that is the time you are not safe.
that's the time you are not safe. So if you need a lot of discipline when you want to use the natural method.
Natural calendar method.
So the natural calendar method relies on your system, like your cycle.
Yes.
And
A lot of discipline.
Discipline, they are fine.
Discipline yourself by your partner.
discipline there, it can go through the roof in 5 minutes.
No.
Seconds.
Depending on what is happening within the wedding.
And you go for emergency.
We'll come to emergency in a bit. But let me re-announce the phone line. So I want to hear from you now. 0541 022318 0541 022318. That's the call line. Do you have a question or a concern about your reproductive health? Do you have a question or concern about contraception, about family planning? What has been your experience with contraceptives and family planning? So Nanaya is saying that she used to do the injectables, but I noticed that I would spot throughout the whole 3 months, and it made me even more uncomfortable, so I stopped. So do we actively tell the women about what the side effects are when they choose the method? Because, most people, when you talk to them about contraceptives, they have a friend's experience to share. And then madam for panini be, and we obolobo, and madam for panini be, and also every day be a no bleeding into medium.
Thank you, Doc. When they come and they make the informed choice, like you've made a choice that you are going for the injectables, everything about it is being explained to you.
Okay.
That you might not even have your menses. You might have it maybe every 3 months. And you can also have a heavy one. We explain all those to you. And with the injectables, that is mostly the hormonals, you are prone to getting spotting.
Okay.
Yes, at a point you are prone to getting it. So that is why we tell you to come. Because if you go in for it from an outsider, when you have all those side effects, you cannot be bothering the person with all those issues. But when you walk into the reproductive health clinic, whatever issue is bothering you, you enter and we help you solve it. If we solve for today, the following week you come with it. We explain to you that if this method is not helping you, let's try another one, which can help you. So for the side effects, whoever has done a family planning method at a well-recognized hospital or clinic, the side effects was explained to the person.
Okay.
Yes, so that when you see it, you wouldn't be alarmed.
You're not bothered.
Yes, you just come in. And a lot of them, when they come back and you give them the antidote to all those issues, they go and they are good to go.
Okay, like they understand
Yes.
that this is what is going to happen.
Yeah.
And that is why it's happening. When somebody has a side effect and then they are uncomfortable, maybe they chose the depot, so they are on injections. They've taken the injection, a few months ago, they are spotting. Can they decide to change their method?
It's your body, and you have a right over it. Sometimes when they come and they won't even change the method, you as a professional, because the side effect she is giving you, you realize that it's not of any much issue. You would want her to continue, but she insists, I want to change it. What can you do? It's not my body.
So you have to understand.
You have to understand and change the method for her. So you go back and do the counseling again,
Okay.
so that she also makes another choice.
Mm.
And Doc, let me chip in this. It's uncomfortable to go through this, but it's very disturbing to get an unwanted pregnancy. This one is uncomfortable, but it's very disturbing to go through an unwanted pregnancy.
Abigail, so you mentioned about cesarean section, and so someone is asking that, can your guests recommend the best contraceptive method after cesarean section? Because, I don't know what a person is thinking, but after cesarean section, maybe that's your first or second cesarean section.
Okay.
Now you want to space the children properly.
Yes.
What is the most preferred method?
When my sister was talking, we talked about the progesterone only.
Okay.
That's the only method that a postnatal woman can take.
Okay.
Because it's not going to have effects on the breast milk.
On the breast milk.
Yes, breast milk production. Apart from that, you cannot take any other.
So that's a pill.
Yes.
You take it every day.
Yes. And it should be the same day, same time.
Same time every day.
Yes. same time every day. You don't mix it up.
Yes.
So if you don't,
Mhm. Go ahead.
and
Go
to
ahead.
say, wow,
Mhm.
now one person will be insane.
Mhm.
And when we are, especially CS, because CS is a cut, it's not vaginal delivery. They tend to return to sexual activity very fast. Yes, than a vaginal delivery. Yes, so most of the time they tend to get pregnant very early. And it's not if you're
Yeah.
it is a one person or benimwa. They is safe for postnatal woman. They progesterone only pills.
Pill. Into why is CS maybe?
And one hospital, unim, no aquatodie. Okotobia, open so this space into no okotobia. I feel breast milk and name, maybe now I won't no food so name, now the number hospital, way come up. It's having effect on the baby, it's having effect on the home and everything psychologically. No person feels a woman won't share because of say
wrong tablet.
Wrong tablet, a combined oral contraceptive having effect on the body. And it's also having combined when we are there's rates of giving thrombosis and all these things. Yeah, we are trying to prevent all these things. It's the person who combine and no. So that's a safe one for
Yeah.
And another safe one is the IUCD.
After CS.
Yes, after CS. So sometimes, even when we are going to the theater, we take it along with us. The person has opted for it. Yes. So just after the procedure,
you put it inside.
Yes.
Oh,
so the IUCD also works. Yes, for them.
So you see, listeners, there are choices. So there are choices to making sure that you have control over your reproductive health. Don't leave it to chance. Like people say, oh, we are okay. Like don't leave it to chance, because you need to have a conversation about how am I going to take care of my reproductive needs. And if, let's say, you've had the number of children that you had planned with your partner, and you want to decide that we've had a number of kids we want, how do we make sure that we are also not making a mistake? All the options are available. I think literally every hospital, every polyclinic, every health center has a family planning corner or a family planning unit where very trained people, very experienced people are there to, talk to you confidentially. When we go to the hospital, open up and tell them what it is, like what is going on, why you want to opt for contraception. And they will give you the most ideal method of contraception, which will help you to space your pregnancies. Now, one of the big conversations about contraception and contraceptive use and a woman's reproductive health, one of the biggest conversations is about emergency pills. Agyeiwaa and Abigail, what are emergency pills?
Emergency pills. In short, there are drugs we take in after emergency sexual intercourse.
I like the expression of emergency section. Emergency.
So it's when the person is not on any permanent or any formal family planning method, and the person knows that this act that I've gone in for today, I might get pregnant. So that is when this woman will go in for the emergency pill, and it's available. It's readily available at the hospitals, at the pharmacy shops, at the chemical shops, everywhere. It's available, because they also get their money from there. When you are hot, even the price doesn't even matter.
I like that.
Yes.
When you are hot.
When you are hot, yes, you would want to go in for the emergency pill.
Okay.
Once a while, you can go in for it. Once a while, but not.
So it's That is also a method.
It's also, and one thing about it, it has high levels of the hormones, the estrogen and the progestins.
Mm-hmm.
Yes, because it's an emergency. It has to distort the system.
Mm-hmm.
Not like, as compared to the regular one, that one will be releasing into the system in minute form. But
Mm-hmm.
this one, because you were not on it, and within a space of about 72 hours, you want to change everything about it.
Mm-hmm.
It has to be high so that it can work for you to distract the menstrual cycle or distract the fertility issues so that you wouldn't get pregnant.
Okay, so Andy is asking me to find out from you. Andy, thank you for joining the conversation. So Andy is asking me to find out from you that is withdrawal part of the methods? I haven't heard them say anything about it.
So withdrawal is one of the natural methods. Yes, please.
Andy, you like headache? You.
It's the most difficult method.
There's all the natural method. It depends on the individual. It depends on your discipline. As I said, yes. If you want to do a withdrawal and you the man when it comes to it, and you are not conscious enough to withdraw, as you said, a withdrawal to withdraw, and a few of the semen gets in. Maybe you withdraw, you think it all has come out, and if you get
one of my lecturers, one Dr. Reverend Rich, he told me that, Gloria, you think you have withdrawn. Even the semen that initially came, some contains sperms. So you were even pregnant before even the guy even released the sperms.
Yeah, some more. So to the person who sent the question, yes, it is a method, but it's
very risky.
Yeah, it's a risky method.
self-consciousness.
It's about being self-aware. It's about understanding that the option that you are choosing.
I was giving health education in one of our churches. When we got around the withdrawal side, we discussed it. This man got up of mommy. I did a horse on the and I was. So what are you talking about? So for that one, it depends solely on the husband. If only the husband is ready to withdraw.
And when it comes to things like that, sometimes they choose that method. They don't want their wife to go for the family plan method. When you say they go for family planning method, if you want me inside the same people. They have that space.
Yeah, I mean it's a question that I was going to ask.
Maybe family planning now. Maybe I want me inside the same me withdraw and go for, especially when it comes to the marriage couples. That's their intention.
But a young lady, so Emily sent me a message and she's saying that so she did the injectables for quite some time, but what she realized is that when she stopped the injections, her menses have not returned for over 8 months, and she's asking whether it's normal.
No, thank you. It's normal in a certain sense because it's hormonal, and you've had it for about 3 years.
Okay.
Yes, so it has to take time for the whole thing to get withdrawn from the system.
For all the hormones to leave.
Yes.
Okay.
And so it's all released from the system. You might not even, because maybe when she was taking, she's one person when she was on the injectable, she wasn't having her menses. So still that hormones, they are still in your system. So return to fertility for the hormonals takes a bit longer time before, as compared to the non-hormonal ones. But the non-hormonal ones, it's instant, especially with the IUCD. There's no hormone attached.
So as soon as you take it out.
Yeah, you've returned back to your system. But with the hormonals, it's in the blood. So even even if you stop it today, it's still in the blood. It has to give the certain time to withdraw from the body before you return to your. It takes some people about a year.
About a year before they return to fertility.
But others too, just within 2 months, 3 months,
they are pregnant. Oh, I had a sister who said, "Oh, Abi, me number some is some method no to me go here and me say me ma and break a crab and come best she got pregnant." And it was like, wow, I said, "Oh, you are pregnant, so let's move on."
And one thing to none of the methods is 100%. None.
It's 100%.
There is none that is 100%.
So it can so far.
Even the IUCD that causes the mechanical changes within the uterus.
Still
you can get pregnant. Some people get pregnant and they come and remove and maintain the pregnancy.
Those are stubborn.
Those are the stubborn ones. So family plan, we don't have any 100%.
And we tell, like, we let the people who are doing, when the women know that.
Yes. And normally happen with the IUCD when you don't check the string.
So it may be in the wrong position.
Yes, maybe the sludge is not in the proper place and it's not working as supposed to work. Yes.
And so then you think that it's there.
It's there. And when they get pregnant, they don't even see it.
They don't even know.
They know that they have something to protect themselves. But they realize that I have some
That would be a very strange experience,
yes. One doctor even got pregnant. She was like, she went to ask her house help. I said, I'm in a boom. So this time, you've had yours, I've not had mine. What is
happening?
But she also left it because she knows something is there. After a month, she came and she was around 8 weeks gone. So we had to come and remove it.
0541022318. This morning we're having a conversation about women's reproductive health, and we're focusing on contraception, and we're taking your questions. 0541022318. What is your preferred contraceptive option? What is your experience, or what has been your experience with contraception and contraceptive devices? Let me pick this call. Hello. Okay, so kindly call back. 0541 022318. You can call back 0541 022318. That is the number to call. What has been your experience if you've gone for any family planning method, and is it something that you would encourage and advise people to go on? Hello, good morning.
Good morning.
Yes, sir. Kindly go ahead, please. Okay, 0541 022318. That's the number to call. 0541 022318. That's the number to call if you've got a question about contraception and contraceptive methods. So, okay, let me. Hello, good morning. Hello, good morning. Okay, can't seem to hear. Hello, good morning. Okay. 0541 022318. I hope we're not having a challenge with the phone lines. I really hope we're not having a challenge with the phone lines. 0541 022318. That's the number to call if you've got a question to ask us this morning about contraceptives and contraceptive choices. So one of the myths that people have about contraception is that if you do any form of family planning, and you are not, how do I say it, and you're not lucky, you may not be able to sustain a pregnancy. Like, you keep aborting your pregnancies because you've done a family planning method. Is that true?
I would say this is never true. Once you're on family planning, it has nothing to do with your uterus. The only thing that has has something to do with the uterus is the IUCD. But with the hormones, it's the hormones that is regulating your menstrual cycle, your ovulation and all those stuff. So it has nothing with you. If you have an incompetent cervix, you will start losing your pregnancies.
Okay.
If you are having some hormonal imbalances, you can lose your pregnancies.
Okay.
So losing your pregnancies, you shouldn't relate it to your family planning method.
It's not a family
Whatever
planning
used.
method.
No.
Okay. Okay.
If maybe the only surgical procedure we have for the family planning is the BTL.
Okay.
And that one, if you do it, it's permanent. You are not going back to fertility again.
Okay. So the BTL is which one?
Bilateral tubal ligation. That is for the women.
Okay.
It's
Just
a
a minute.
permanent.
Hello. Good morning. Hello. Good morning. For some reason, I cannot seem to hear you when you call. I don't know. I hope it's not a network thing. I really hope it's not a network thing. So there's a question here. She's saying that tell them it's not only the other methods, but condoms can help couples too. If you don't take care, IUCD, now you give birth to 3 other children aside your 4. Hello, good morning. Hello, good morning. Hello, good morning. I don't know. Maybe it's the phone lines. Maybe it's just the phone lines that are acting up. Maybe it's the phone lines that are acting up. Yes, but you can, like they said, you can be doing the IUCD, but you need to check the position of the IUCD every time you have your menstruation, right?
Especially when you get a heavy flow.
Hello, good morning. Yes, I think it's your positioning. Can you go ahead with your question, please?
What is the side effect of having this contraceptive?
Okay.
Some might have it, and after removing it, they may never get pregnant.
Okay. All right. Thank you very much for your question. So what he's saying is that what are the side effects of these contraceptives? Because like I asked earlier, some people take it out and like you said, they never get pregnant again. Is there a reason why that happens?
It's hormonal. So the side effect depends on the how your body is reacting to. So when you come, we explain all the side effects. Some people take it and they have mood swings. Some people lose weight. Yes, it's hormones. Just as when you are pregnant, some women will have mood swings. Others will also be free and walk around. It depends on your body. So some people will have weight gain. Others will have weight loss. Others too would also have increase in their appetite.
Okay.
Others too would say that they've lost appetite ever since they started taking the contraceptives. Some people also, when they take the hormones, they can have a slight increase in their blood pressure.
Okay.
Yes, some people have some slight increase in their blood pressure. And others too, when they get it, they can also have low blood pressure. So that is why when you come to the clinic, before we even continue or give you another method or continue with the one you are using, we check your weight, your BP, everything to know that you are progressing in your weight, you are losing it, your BP is also going up. If it's too high, we wouldn't stop the method instantly. We will tell you to visit your physician, your physician to start you on medication. If he starts on a medication and still it's not coming down, we might decide to take it out and see if it's the cause of and even the BP and the high blood pressure that it causes is not that much. For it to be 180, 120, no. There will be some slight increase in your blood pressure, but not much.
Okay, so you do some tests. Go ahead.
Yes, and when someone walks into the hospital or the clinic and wants the method, a full head-to-toe assessment is being done for the client. And the head-to-toe assessments also help us to advise you, give you the education that you need to make that informed choice. Based on the assessment, as my sister said, vital signs is also being done. Your BP, the pulse, your weight, everything is being checked. And based on all these things, will be added plus the type of contraception that we put on the table. Yes. So you don't choose out from your imagination, but you choose based on your assessment that is being done at the clinic. So if your assessment, the BP is being checked and you are having a very high BP, we know based on your BP, this method is not going.
So like you screen before you even pick the method.
Yes. If you're having any cardiac condition or any hormonal condition, yes, we know the method. We take the method that is not going to help you out from the ones that you have to make an informed choice on. Yes. So based on that,
when they are coming with their method.
Yes. So we
You see, so someone sent me a message. Let me read it for you guys. So what she's saying is that she's saying, Doc, the method I really like is the combined oral contraceptive pill. The reason is that it gives me good skin.
Wow, you see.
Yes.
Even it's my first time of hearing this.
Yes.
Yeah.
And some people, the weight that they gain, it's not that much. It gives them that feminine weight. That feminine weight. Yes. The hips there. So some people, it's really make them feminine.
Oh.
Yes.
Okay, so there are some possible other benefits.
Yes.
So some gets, like she's saying, like she gets a very good complexion on her skin. I'm saying that all her acne goes away. So she's on the oral contraceptive simply because, besides the advantage of preventing an unwanted pregnancy, it also gives her good skin.
So Doc, with the side effects, you also have some irregular menstrual cycle.
Okay, you can have irregular menstrual flow.
Yes, irregular, especially with the hormonal ones. And sometimes the amenorrhea, you don't even have your menses.
And that is normal. That's as a result of the contraception.
In your system, yes.
It's not that you are pregnant.
It's not that you are pregnant. You are not ovulating. When you ovulate and you don't get pregnant, that is when the endometrial tissues are shedding.
Yeah.
But you've not ovulated. So where do you want this?
So it's usually the other conception or misconception with contraceptives that may give you amenorrhea or stop you from menstruating. That people think that once you are not menstruating, they are going to get a fibroid and the mujano a crocodile baby. Is that what it is?
It's a cycle. Menstruation is a cycle. So when you ovulate, the hormones that produce also help in the growth of the uterus, the lining of the uterus. We call it proliferation. So when you are not ovulating, these cycles are not happening. Yes, for you to shed that lining out during menstruation. Yes, that's why you don't have your menses. It doesn't mean mojano eba then the position baby na cabo na fibroid baby. It doesn't happen that way.
Okay.
And one thing too is the contraceptives. Sometimes it's also used for treatment. Yes. Some people are taking it
Not because of
because they don't want pregnancy, but they are using it as a form of treatment for other things.
Okay. So okay, since her name is Ota, so what she's saying is that the difficulty with choosing contraceptive methods, is that sometimes the people who are themselves explaining the contraceptive method to you have not used it and are not able to honestly tell you what the side effects are. They are only telling you what they may have read in a book. So since I want to know whether the side effects that they are saying are side effects that
See, when it comes to side effects, when you say side effects of a particular drugs, It's a research that being done. People are being taking that medication, research being done on that number of people, and it comes out like these medications, there's a side effect that comes out from it. It may not be particular
with
me,
you,
Abigail, sitting here. Yes, that if I take Depo-Provera, I may be having heavy menstrual bleeding.
and of
But
course,
someone who
you
takes
can't
it-
try all the side,
Yes.
all the methods
And
there.
someone who
It's
takes
my
it-
first time of hearing that the oral is helping someone's skin.
someone who
So
take
we
it
cannot
will not
let
even
all.
bleed. It will not even have a menses, as we are saying. And someone who take it will be having a spotting. Yes, and someone will never have a spotting. Someone have a very good
Skin.
right now.
So it's a side effect of having a good skin. It's
The side effect of the medication.
Yes.
So when they come and we are giving them the education, it doesn't mean that what we have passed through is what we have to tell them. It's something that is being documented. It's something that is being documented based on the medication that we are giving to you. We have learned, been trained on these medications, and we are administering these medications to you. Yes. So it doesn't mean that I have to go through these process to be able to tell you the benefits and the disadvantages of these medications.
Okay, so Kojo is saying that kindly ask your guests if the contraceptives increase or decrease libido in females. He's saying that my wife started taking the contraceptives, and now every time we have to. Agyeiwaa, you are making things go up in places for people.
Look, it's the individual's body's response to the hormone. Some people are taking it and their libidos are also going high. Yes, others too take it. So just as this listener is saying that we are not telling them the facts about the drugs because we have not gone through it. It's the same thing. Some people are taking the injectables and their libido is diminished. Others too are taking it and it's increased. So when we come, even in the books, is there the fluctuations in your libido. It's even the when they come, we explain all those things to them. So sometimes it's psychological, but it's our boss on it gets effect on the mind, and it starts working on the individual. Yes. So it's there. When you give them the side, you definitely one or two people also come and confirm that this is happening to me. So for that one, we have no power over that thing. If the method is not helping your wife, there are other methods.
Oh, but if the libido goes up,
But this one, the man is saying the libido has reduced, which is bothering me.
So when you start, I even said when you ovulating, your libido
Goes
up.
the injections or the hormonal contraceptives, the hers has gone down.
has gone down.
So then, if it's not helping, she can come.
You can come for
And if she's
non-hormonal.
not having her case, the BTL is also.
So the BTL is what? The BTL is the one that they do what?
They tie the tubes.
They tie your
Your
tubes.
tubes.
Okay.
So fertilization is out. But
So
there's
that
a
one
chance.
is that one. There's a chance, but that one when you do it, there's a higher probability that
you are not getting
you're not getting
pregnant.
pregnant.
In your lifetime,
Yes.
yes, please.
Okay, and that's advisable when you know you have completed your family.
And also advisable when the woman is having a high risk, having medical conditions.
Okay.
Like the one is having a heart problem, and cardiac infarction, whatever, diabetes, uncontrolled diabetes, and be able to have about 3 or 4 kids. Yes, and if you go for this hormonal, it's going to because it's hormonal, it's going to also have interaction with all these things, the smooth muscles, your heart, and those things. So that permanent method is also good for clients that is having medical conditions. Yes.
Okay.
It's very, very important.
That's good to hear. I mean, that's excellent to hear.
But there's some for men too.
We'll come to the men in a bit. Let me announce the phone. 0541 022 318. I hope the phone lines are working now. 0541 022 318. That's the call line. That's the call line. If you've got any question to ask me and my guest this morning about contraceptives and contraceptive methods, options and choices, we've done for women largely, but Agyeiwaa informs me that there are also some for men. There are contraceptives for men?
Yes.
Hey!
Yes, the first one is the abstinence.
Agyeiwaa.
And you have the vasectomy, that one too is a permanent. The abstinence, it will never work.
Abstinence.
This one,
I
if
don't
you
even
abstain-
agree.
If you abstain, you're not going to get anyone pregnant.
I don't even agree. I don't
The
want
condoms too are there for men.
Uh-huh.
It's for men.
So-
we have the male condoms for
Yeah,
men.
uh-huh.
Yeah.
Okay.
And we also have the vasectomy, which is a permanent method.
So vasectomy is a permanent method for men.
Just like the BTL.
Be-
that's the-
So okay, so explain to us who want to do vasectomy. What is it like? Does it mean that the man is impotent
No.
or cannot have an erection, or what is it? Because see, for men, when you say vasectomy, only one thing comes into people's minds: so impotence.
No.
Okay.
They work even stronger when you have vasectomy.
The gospel according to Agyeiwaa.
It's just, it's just that you produce the semen without sperms.
Mm-hmm.
So the vast difference are being tied. So when you get pregnant, you produce, when you do the vasectomy, you produce the semen, but it doesn't contain sperms. Nothing is being disrupted from the male's reproductive anatomical structure, nothing. It's just that you produce the semen, but you are not having sperms to impregnate a woman.
So like normal, everything will come,
normal,
but there's no
everything.
sperm in it to go and fertilize an
the
egg,
ovum. Yes, please.
and that one is permanent.
It's permanent.
I can't reverse it.
Yes.
When you do it, you've done it.
When you do it, you've done it.
Uh,
Just as there's a slight chance for women.
There's also a slight chance for men.
yes.
So for the men, maybe, if you think that your wife has suffered enough,
And she's proving stubborn not to go in for family.
and she's uncomfortable with family planning, you can go for yours. Do the vasectomy. It's not a long procedure.
No.
It's not a long procedure at all.
finish your workout.
You finish and you can just walk home.
Yes.
You can just walk home straight. And, that one, that everything is fine. Sealed, you're okay. There's, 99.999% of no chance of you impregnating, or having another baby with your wife or your partner. And it also sets your mind at ease. It gives you the chance to also plan and take care of yourself. So someone is asking that earlier your guest mentioned about infections with some of the contraceptive methods. Besides the IUCD, do the other contraceptive methods, as the injections and the pills, does it increase infections like vaginal infections in women?
Thank you. For that one, the only infection it can cause is the local site where the baby injection was given. But aside that, for the infection within the reproductive area, no. Listen, it's a foreign body which is being introduced. That is why you are at risk of getting the infection. But aside that, none of the methods will put you at risk of getting the.
And if you're able to take care of yourself well, you don't douche, you don't just insert your hand into your vagina without, like when you want to even check the string, you have to wash your hands properly before you insert your hands in. And you have to prevent yourself from getting sexually transmitted infections. Yes. Especially when you have the IUCD in there. Yes. So normally we tell them, if you are sexually active and you don't have one partner, it's better you use condom to prevent yourself from getting this infection. Because when you get it, can spread to the uterus to have getting pelvic inflammatory diseases. Yes.
I mean, those days I remember in your unit you used to share condoms freely. And you used to do it.
Yes.
But
But just with some small amount of fee you pay, you get plenty.
I remember those days when we were
No,
young.
it's not free. We give it. If you come and you don't have the money, we give it. but
Oh, a young
they
medical
come to the
students.
field.
You go to the family planning, then they have like a box, like a Shimbe
And
100.
people will go out and sell it. They come for it for free, and they go out to sell it. But now with just I think just 10 CDs, you get a whole pack.
A whole pack. Yeah, I think.
They'll be coming there.
Please come, please.
Oh yes.
Go to the Confanochi family planning unit. They have, it's like 100 for 10 CDs. Plenty. And
Every time we had for the female, people don't use it at all.
okay, so they are female condoms.
Condoms too, yes.
Are they popular?
They are not as
People don't
popular
like
as the
it.
males, yes.
Yeah, because they say it's complex.
It's
Like
complex,
it's
yes.
it's
What are the
complicated.
steps you have to take before you have to insect
No,
it?
for
And
that one, you even insert it before the action.
Ah,
So that one even doesn't interrupt the sex.
so you have to insert it
For the
before.
male one, the man has to be
Erect.
erect
Mhm.
before, but with the female, she has to do it even before the action starts. So that one doesn't even interrupt the sexual activity.
So the women, like we have that one too. There are female condoms. There are female condoms. I know someone is listening is trying to picture it. Don't picture it. You can go to the unit, ask for one, and look at how it looks like. It's very, very nice. It's really, really nice. I mean, you know, there are options for you when it comes to your health, it comes to reproductive health. So like Agyeiwaa and Abigail said in the beginning, don't just walk into a place, talk to somebody who is not qualified, talk to somebody who doesn't know, and they just give you something for something. Please. There's a question that came earlier, and how often can you take an emergency contraceptive within a month?
In a year once. Yes. In a year once. At most, twice in a year. Yes, please.
The whole year?
Yes. Yes.
Once?
Once.
some have been taking it every month.
Some take it every weekend.
Those who don't know their cycle, they will take it every weekend because they are not too sure. Every time they have sex, they are not too sure. But if you know your cycle, you know that this week I'm free.
So please talk to a midwife, talk to a women's health specialist, talk to your obstetrician, talk to your gynecologist, talk to a qualified person, your friend, Google, what do you call that thing, ChatGPT. All those people are not doctors, they are not nurses, they are not midwives. Talk to a healthcare provider who is qualified and experienced in the area, qualified and experienced in the field, and get the right advice. Because you cannot play cha-cha. You cannot gamble with your reproductive health. You cannot gamble with your reproductive health. Like they said, they are there. How do we find you? Agyeiwaa, where are you? Abigail, where are you?
We are all at Scats.
They are at Confanochi.
Ops and Gynae unit.
Where's Ops and Gynae? We don't know Ops and Gynae.
A block reproductive health for provision of contraceptives. We are the reproductive health clinic, which is the family common known as the family planning.
Family planning, that's around Poly.
Poly area, yes. Mostly me, I don't like using the word family planning because other women have other issues, not solely on family planning.
And then they come there.
Yes, yeah. So we are there for all issues concerning women, including family planning. Yes.
Okay.
So polyclinic, just behind the whole building of polyclinic.
Yeah,
that is the last building.
Yes.
at the polyclinic.
So when you enter
You just
Confanochi,
ask the security.
just ask the security personnel that you want where family planning is. It is just behind the main Confanochi Poly. If you are standing on the Bantama Road around Limo Pharmacy, you see the building. There's a nice yellow building there. Go there, take your time. Listen, hospitals, you don't have to go there feeling shy. There's nothing under the sun that we haven't seen. Come, or head. Ask all, listen, take your time. Ask your questions. The midwife, the women's health specialists, the doctors who are there, they are your friends. Take an interest in, Charlie, clear your doubts and make sure that when you're going home, every question has been answered for you and you have made an informed choice. It's not like you go and they give you something and then you go and try. So, I mean, that's my advice for the weekend. we are 3 minutes from the end of the show. Guys, any final words before we run out of the studio? Abigail, you have the first.
Okay, so I wanted to say we should take key interest in the family planning method that we are talking about here. Because if you don't want a pregnancy, you end up trying to take it out. And there are consequences for taking it out when you don't see professional assistance.
Exactly.
Yes.
Exactly.
So we should be interested in taking the family planning very, very serious. We have a lot. I am in Confanochi ONG Department Ward 3, the gynae ward, where you get a lot of teenage people coming in with their septic abortions.
Yeah.
If they have undergone have these services at their disposal, I don't think they will have the pregnancy. And because of the stigma, coming to the hospital to seek the advice that they need when they get the pregnant, they tend to have their friends helping them to take it out, and it end up being septic. And we had a case that the client bled for almost 2 or 3 weeks and didn't want to come to the hospital. You have to transfuse the clients with a lot of blood. So we are appealing. As women, we should take our health very, very serious. We should go to the family planning units, get the knowledge and understanding of all these methods, make an informed choice. And that will also help you have a good health to take care of your family.
Thank you very much. Agyeiwaa.
She said it all.
Then say hi to your husband.
So my few words there, like, no matter the duration you want to space. So if you just want to space it for 3 months, you have your method. If you want to space, because when I was even talking about ICD, I told you that it can take 10 years. It doesn't mean that when you insert it, it should take 10 years. If you insert it and within 6 months you want it out, it could be removed. Yes. So no matter your choice, the duration you want to go, so you have the short and the long, whichever you would want, just come. And the services will be provided for you. Get a free mind to enjoy whatever you want to enjoy. Not forgetting the sexually transmitted disease. Because all the methods doesn't prevent the STIs
and HIV.
So we should also bear in mind. Women's reproductive is so broad that we cannot consume all today.
Definitely not.
Yes.
Definitely not.
So I think next time we'll talk about another method concerning our health. So we should take care of ourselves because we have a big role to play in the society.
All right.
Big ups to my husband. Remember for the same what.
And my husband Charles Agyeiwaa. And my kids, I know they are listening because I told them to listen. Edward, Sylvia, Shifra, and Ezekiel.
All right. See? And that brings us to the end of another exciting show. We're excited when the midwives come, right? Join us again next week, Saturday, from 8 a.m. to 10 a.m. here on Orange 107.9 FM. And join us for another discussion on your health. My name, as always, is Dr. Kwesi Jima. Good morning to you all. Enjoy your Saturday. Bye.